Hello everyone, this is Marika and I welcome you all to this new session of Nursing Management with me. In our previous sessions, we have discussed about patient classification system, wherein we have seen what is patient classification system, what are the purposes of PCS, and also the importance of patient classification system. In this session today, we are going to discuss the types of patient classification system. We have already seen what is patient classification system, and we also know that there are different types of patient classification system. Now today in this session, we are going to see in detail what are the different types and how are patients classified into different categories in each of those types. First of all, let us quickly recall what is patient classification system. We have seen that a patient classification system is a system of categorizing or grouping the patients into different categories according to the time that a nurse has to invest to provide care to the patient, and also the complexity of care that is to be provided to the patient. So when we categorize the patient into different categories, we see that how much a nurse has to invest her time to provide the care to the patient, as well as what is the skill that is required for the nurses in order to provide those necessary care to the patient. Now, according to the complexity of the care that is being rendered and according to the time that a nurse has to invest, patients are categorized into different groups. Patient classification system helps the nurses to divide their workload to see where more number of staffs are required. It also helps to provide the necessary required care to all the patients. It also enhances the patient satisfaction as the patient is given the required amount of time, and it also improves the staff satisfaction as the workload is equally divided, and also the staffing needs of the organizations are identified through patient classification system. So now let us move on to the types of patient classification system. There are majorly three different types of patient classification system. The first one is called as factor evaluation system. The second one is called as pro-type evaluation system. And finally, we have DRGS, which stands for diagnosis related group. So when we see the types of patient classification system, we understand that the classification or the categorization of patient is done in different ways in three different types of PCS. Patient classification system is followed in almost all the healthcare agencies, in almost all the hospital, but there can be different types of patient classification system that is followed. Let us see in detail one by one what it is. The first one, as I said, is factor evaluation system. Factor evaluation system is one of the most commonly used patient classification system. It is used in almost all the healthcare agencies. Now, what actually happens in factor classification system? In factor evaluation system, certain factors or descriptors are identified. The descriptors can be activities of daily living or the routine activities that are carried out in the ward. For example, the hygiene, the grooming, feeding of the patient. Now, this particular element or descriptor is further divided into sub-elements. For example, if we take feeding as a major element, it will be further divided into other sub-elements. The first one can be patient feeds oneself, which means the patient is able to feed themselves. The second one can be the patient requires a little assistance from the nurse. The third one can be the patient is majorly dependent on the nurse, and last one can be tube feeding. So these are the sub-elements of the major element or the major descriptor feeding. Now, each of this sub-element will require different time in order to complete the particular task. For example, if the patient requires only a little assistance from the nurse to feed oneself, the amount of time that the nurse invests for that particular time will be different than the nurse providing a tube feeding for the client. So for each of the sub-element, a particular specific time will be given. So each of this activity is quantified from the least amount of time that a nurse has to invest to the highest amount of time that the nurse will require to complete the task. And as I said, the common care descriptor can be hygiene, mobility, feeding, medications, skin care, respiratory care, etc. The normal activities that are carried out in the ward. And the level is differentiated according to the time that the nurse has to invest or the complexity of the particular task. So I hope you've understood what is factor evaluation system. The second type we have is pro-type evaluation system. In pro-type evaluation system, the patient are majorly categorized into 5 different category, which is category 1, 2, 3, 4, and 5. Unlike the factor evaluation system, in pro-type evaluation system, patients are classified into categories in a broad category. So let us see one by one what does each category include. The first one that we have is category 1. In the category 1, we have the patient who comes with acute illness and the patient with episodic illness who have the ability to return to their pre-illness functioning. So in category 1, those kind of patients who comes with acute illness and who have the ability to return to their pre-disease functioning, and for the healthcare worker, the only aim is to treat the existing health problem or to help the patient relieve the existing health problem, are all categorized into the first category. In the second category, patients who have chronic illness but with acute episode who also have the potential to return back to their pre-disease functioning are categorized. We have to understand the difference between category 1 and category 2. In category 1, we have seen that patient who comes with acute illness and the patient who have the ability to return to their pre-disease functioning were categorized in category 1. In the category 2, we see that patient with chronic illness with acute episode but who have the potential to return back to their pre-disease functioning are categorized. So in category 2, we have such kind of patients whose chronic disease condition can be managed by the patient himself or also by the family members. The next one that we have is the category 3. In the category 3, there are patients who have chronic disease and also has the possibility to return to the pre-illness functioning. But in the third category, we see that the patients will have increased chance of improving their functioning if they are provided with proper medical support. So please try to understand here that in the second category, the patient had chronic illness but the episode was acute and the patient has the potential to return back to the pre-disease functioning. In category 3, the patient is suffering from a chronic illness and here also the patient has the possibility to return to the pre-disease functioning, but the level of functioning in such kind of patient can be increased when there is proper medical assistance provided. So such kind of patients are categorized in the third category. So in the third category, the goal of the nursing professionals or the healthcare professional is maximum rehabilitation of the patient with the agency support, which means the patient can improve their functioning with the support of the medical team. The fourth category in the pro-type evaluation system includes the patient who are suffering from chronic disease who cannot be managed without an ongoing medical support. So in category 4, those kind of patients who will not be able to manage their illness at home or without the assistance of the medical professionals are usually grouped. And the last one that we have is category 5, and in category 5, patients with end-stage illnesses are usually categorized. I hope you have understood what is pro-type evaluation. In pro-type evaluation, we have 5 major categories, that is category 1, 2, 3, 4 and 5. In the first category, patients who have acute illness and who have the potential to return back to their pre-functioning level are kept. In the second category, we have patient with chronic illness but with acute episode and also having the potential to return back to the pre-disease functioning. In the third category, we have patient with chronic illness, and in the category 3, we have the patient with chronic illness who also have the potential to return back to pre-disease functioning, but with medical assistance, those kind of patient can function in much better way. In the fourth category, we have patients suffering from chronic illness who cannot be managed at home or by family members without the assistance of medical agency. And finally, the fifth category has the patient with end-stage illnesses. The next type of patient classification system that we have is called as DRGS, which stands for Diagnosis Related Group. Now, in Diagnosis Related Group, the patients are classified into different categories according to the prospect payment of the patient. In DRGS, there will be a certain predetermined price for all the patients. Or we can also say that a predetermined price for the stay of the patient within the hospital. According to the socio-demographic data, diagnosis and the therapeutic uses of the patients are categorized into different groups at the time of discharge. So these are the different types of patient classification system. The first one that we have is factor evaluation system. The second type is the pro-type evaluation evaluation system, and the third type is diagnosis related group. In factor evaluation system, different factors are identified, different elements are identified, they are further divided into sub elements, and a certain set of time is given for each of those tasks to accomplish. In the pro-type evaluation, we have seen 5 different categories, and finally we have diagnosis related group, in which we see that the patients are classified into different categories according to their diagnosis and the type of facilities that the patients will use during their hospital stay. So that is it for today's session. Today we have discussed a very short and an interesting topic. I hope the class was helpful. I'll see you all in the next session. Thank you and have a great day ahead.